I'm Dr. Melman. I'm one of the surgeons here at Advanced Surgical and Bariatrics. I've been in practice for almost 10 years now. Gastric bypass is a surgery that is very commonly performed, and in fact is the most commonly performed surgery for weight loss worldwide. It helps patients lose weight over time, and it is known to be one of the most effective tools to help patients lose weight permanently. It does not make patients lose weight. It's just a tool to help you be successful with weight loss. So patients still have to do the proper diet, they have to be active, and they have to be exercising, and they use the surgery as a tool to help them succeed. Interestingly enough, gastric bypass in terms of the surgery can be used to help patients with obesity, and it can be used to help patients with reflux disease, and it can be used to help patients with diabetes. So even patients that have diabetes but not obesity, reflux but not obesity, can get a gastric bypass to help them improve their condition. Patients that have morbid obesity, reflux disease, and diabetes are ideal candidates for the gastric bypass because it treats all three conditions. So we sit down with the patients and we look in detail at their medical history, their surgical history, their medications that they take, any allergies to medications that they may have, if they've had bariatric surgery in the past or not. And then I always ask them, what are your goals? What are you looking for? How much weight are you looking to lose? What are you wanting to get out of this? Very common questions are, how long does the surgery take? The gastric bypass takes about 2 to 3 hours. There's a lot of delicate sewing and sort of connections that we need to make in the tissue. All the surgeries that we do, including gastric bypass surgery, are done with very small incisions and they're under general anesthesia, which is very safe. Other common questions are, how long does it take to recover from the surgery, and what is my life going to be like after the gastric bypass? So basically, patients that are in a desk type job that just sit at a desk in the air conditioning, or they're not doing any sort of heavy labor lifting or physical work, can be back to work within about a week, sometimes 2 weeks at the most, but they have very little pain. Not a lot of them even take any pain medications afterwards. Gastric bypass has actually been around for about 50 years already, so it's come through various refinements over time as our technology and our visualization technology in the operating room becomes better over time. I would say that in our practice, we have about 8,000 patients that we've helped see through the process of consultation to post-surgery. So we're very experienced. We're one of the most experienced practices in the Northeast and have helped thousands and thousands of patients through the gastric bypass successfully.